A total hysterectomy means you've had all of your female organs removed. Everything's cleaned out from there. And a partial hysterectomy means you still have your ovaries, right? Wrong, wrong, wrong. This is some of the most commonly misused nomenclature that I hear in the office. And it can be very confusing to patients. It can be difficult to obtain histories. And using the proper nomenclature and understanding the different procedures for hysterectomy and other pelvic surgeries is essential to understanding what is going on. I'm Dr. Monica. I'm a board-certified OBGYN and mom of 3. And in this video, I want to explain to you the different terminology that is used for hysterectomies, the proper medical terminology, and helping you understand what procedures mean what is done to your body. So let's get into it. So to start us off, let's talk about what is a hysterectomy. A hysterectomy refers to the removal of the uterus, and in part with that, the cervix. That is all that a hysterectomy refers to. So if we look at our diagram here, where I have a hand-drawn example of a uterus, if you're looking at this diagram, this is the uterus, this is the cervix, these are fallopian tubes, and these are ovaries. So a hysterectomy refers to removal of the uterus and the cervix. A total hysterectomy means that the uterus and cervix were removed. That is all that a hysterectomy refers to. It does not refer to removal of the fallopian tubes or the ovaries. Those are a separate procedure, which I'll explain to you in a minute. Now, there are two kind of subtypes of the hysterectomy. The total hysterectomy, like we said, removes the uterus and the cervix. Something called a supracervical hysterectomy removes just the uterus and leaves the cervix behind. Now, generally, when we do a hysterectomy, we plan to do a total hysterectomy. It's not generally something that's done ahead of time to plan to want to leave the cervix in place. At one time, that is something that was done due to concerns for sexual function and bladder dysfunction, but studies have shown that there's no difference if the cervix is removed or left in place. We plan to remove it because then, once that cervix is removed, if the patient has never had any advanced cervical dysplasias or precancers, their risk of cervical cancer is extremely minimal. So we do generally plan to do a total hysterectomy. Sometimes we do end up doing a supracervical hysterectomy and leaving the cervix behind, usually in cases where there's some type of struggle with the surgery. Sometimes in patients who have had multiple C-sections in the past, there'll be a dense plane of scar tissue with the bladder and the cervix, and sometimes the surgeon will decide that the risk of injuring the bladder and injuring that area because of the difficulty seeing makes it not worth the risk of trying to get the cervix out, and we'll go ahead and just remove the uterus. There are a few other instances when the cervix might be left behind, but generally that is an intraoperative decision that the surgeon decides is safest for the patient. We don't usually plan to do a supracervical hysterectomy. So given that that's a hysterectomy, what about the fallopian tubes and the ovaries? Back to our hand-drawn diagram. So these are the fallopian tubes. The term for removing the fallopian tubes is salpingectomy. So a salpingectomy removes the fallopian tubes. This is a separate procedure from a hysterectomy. Generally, when we're doing a hysterectomy, we will remove the fallopian tubes. Those were only there to allow a sperm and an egg to meet up to conceive a baby, which you certainly don't need when your uterus is being removed. So we do remove the fallopian tubes to reduce your risk of having ovarian cancer, which can actually start in the fallopian tubes. Now, what about our friends, the ovaries? So the ovaries here, removing the ovaries is called an oophorectomy. So this, as you can see, is a totally different procedure from hysterectomy. Now, a lot of the time when we are doing surgery and we have decided ahead of time to remove the ovaries and the fallopian tubes, they will be removed in a combination procedure called, get ready, this is a long Latin word, a bilateral salpingo-oophorectomy, which, as you can see, is a combination of salpingectomy and oophorectomy. So what people will often come in and believe is a total hysterectomy is actually a total hysterectomy and bilateral salpingo-oophorectomy, or BSO, which is a short, easier way to say it. That means that the uterus, cervix, fallopian tubes, and ovaries have been removed. In addition to the total hysterectomy, the BSO, which removes the fallopian tubes and the ovaries, is what results in you having all of the female organs removed from the pelvis. So I hope that explains the difference. There is no term of partial hysterectomy in the medical world. That is something that has very much been adopted by the general population because it makes sense to think that some of your organs were left behind, but it really does not relate to medicine. Now, I think it's really important to use the proper terminology because you should understand what's happening to you. You should know if you're having a procedure done, what organs are being removed, what is the name of the procedure, and what does it mean. Education is empowerment, and when you're consenting to something and deciding to have a procedure done, you should understand what it is. I think that there may be some times when clinicians aren't as big on correcting people's terminology because it is so common. The vast majority of people who I see in the office will use a term like partial hysterectomy. They'll say, say, I'm interested in a partial hysterectomy, or I'm interested in a total hysterectomy. And it doesn't mean what we think it means. So we should all be on the same page. The other thing that's really important, even though it sometimes takes time and is a little bit hard to say, well, I think I understand what you're talking about, but here's the actual terminology we use, like what lines up with what you were thinking. It's important that we're on the same page ahead of time. In today's day and age where we have things like patient portals and Epic MyChart, it would be very upsetting, I think, for a patient to not have really been cleared up on what the different procedures are, go under surgery thinking that they're having a partial hysterectomy, and then if they see their op note on their portal and it says total hysterectomy, because as we said, that would be the procedure that's done, a total hysterectomy without removing the tubes and the ovaries, they might freak out a little bit thinking that they were supposed to have one procedure, but then it looks like there's documentation of a different procedure. So if everybody's on the same page, everybody understands, and that makes everybody more comfortable. If there are any questions or you want clarification on things I've said, please leave me a comment. I'd love to address those. Otherwise, I'll see you next time.